I'm Candace. I'm going to be doing the trach care skills video. I have introduced myself, identified my patient, explained the procedure, closed the door for privacy. I have all of my supplies, my trach kit, clean gloves, hand hygiene, and normal saline solution. First, I am going to apply clean gloves and remove oxygen if there is oxygen on the patient. My patient is in a comfortable position. They are in semi-Fowler's or Fowler's position. They don't have any questions. I already answered them. I'm going to then remove the soiled dressing and discard of that, remove my gloves, and perform hand hygiene. I'm going to then open the tracheostomy care kit away from me and set that down. I'm going to remove the sterile gloves and set them down so for when I put them on. Also going to take the drape out, ensuring that I'm only touching the shiny side, not the inside. I will be placing that down. Going to take the contents of the kit and place it in the center of there. Going to pour solution into the kit. That way it's ready for soaking. Going to then apply my sterile gloves. When I open them, I'm going to make sure that I'm only touching the 1-inch border on the sides to ensure that I don't break sterile field. When I put the gloves on, I'm going to slide my hand into the glove, not touching anything other than the folded cuff. Then with my gloved hand, I'm going to then put it into the cuff to ensure that my other hand can go in it and not break the sterile field. I'm going to keep my hands above my waist to keep the field sterile. I will then while my hands are sterile, I'm going to rearrange this kit stuff, placing the swabs into the solution to soak along with the brush. Then from here, I'm going to unlock the tracheostomy cannula and place that into the solution. Going to take the brush and clean the cannula and place it back into the patient. Make sure it's secure and locked. I'm then going to take some of my gauze or the Q-tip and clean around the patient to make sure that there's no, that it's clean, there's nothing dirty, no secretions or buildup of anything, and discard that. I am going to take the gauze and pat dry around the area that I just cleaned to ensure that skin is dry. Discard of that. I then need to change the ties. I'm going to need a second person to hold the trach while I am changing the ties. remove the old ties and discard. And like I said, in the real world, somebody else would be helping me to hold the trach in place. So I'm going to feed this in. Patient is still very comfortable, no complaints of pain or discomfort during this dressing ties change. And then I'm going to make a small little tie right here to ensure that it stays in place. I will be making a little spot for that. I'm going to take a 4x4 square and tie it or fold it in half and place it under where the knot is at, and I'm going to tape the knot to the gauze to ensure that it doesn't move and there isn't any pressure on the skin to cause any skin breakdown. I'm going to replace this dressing. Make sure that it's nice and pretty. I'm going to clean up my mess and make sure that it doesn't have any questions. Everything feels comfortable and okay. I'm going to remove my gloves. After I've cleaned up my mess, put the bed back in a position, the lowest position, and I'm gonna perform hand hygiene.